All right, Chelsea, take it away.
Hi, everybody. My name is Chelsea Norris, and I'm one of the program managers for Healthcare Analytics Certificate here at Continuing and Professional Education at UC Davis. Thank you for joining us today for our information session. We're very excited to talk with you and answer all of your questions. We're going to go ahead and get started. If I can advance my slide. Oh, there we go. Did I miss one? Okay. Thank you for bearing with us on that. So today there's a team of people here to answer your questions and talk about the certificate with you. Again, like I mentioned, my name is Chelsea Norris. We also have Heather Ogle with us today, and she's the program coordinator. She's the one who will be responding to emails and phone calls and taking care of all the logistical aspects of registering for class and the certificate and answering your questions there. And we will give some contact information at the end of the program so that you can contact with Heather. Brian is also with us today, and he's an instructor with our program. Brian has been with us for, oh gosh, I want to say 5 or 6 years, but I will let him nail that down. Brian, would you like to go ahead and introduce yourself?
Oh yeah, welcome everyone. My name is Brian Pachotti. I think I've probably been with the program for at least 6 years, maybe, yeah, about 6 years. I teach 2 courses, so 201, 203. So there's healthcare data acquisition and management, and then the quantitative methods and decision analysis course. So real quick, I'm from New Mexico, went to school in Colorado, got a PhD in organizational behavior at Davis, spent a lot of time in Africa. I've been doing healthcare analytics and data science for about 15 years. I currently work also at the UC Davis Med Center doing informatics and analytics work, and currently a lot of COVID data analysis. What do I like to do? I love to travel. I like to try to learn to speak Italian because I tried to become a citizen of Italy recently just for fun. So yeah, welcome everyone.
Thanks, Brian. We're really glad that you're here today with us. In the upper left-hand corner, you'll also see a box that says Student Services, and that's a direct phone number and email address to our Student Services Department. So if you need to reach out, if you're having a logistical issue registering for a class and you don't need to speak specifically with Heather, then that is a great resource for you. So before we continue on, I just want to express that this is really your session. So the 3 of us are here today to make sure that we give you the information that you need in order to decide if the HCA certificate is for you and will help you, or maybe if it's not right, it's not going to be right for everybody. And so we want to make sure that we answer those questions and get you that information today. Heather will be following up our session by emailing you some more information and also a recording today so that you can rewatch the session if you would like to. Here's our agenda. So these are the main topics that we will be covering today. If you have questions, we would love for you to not hold on to them. Go ahead and enter them in the Q&A. That's the question and answer box that you should see on your screen. Go ahead and type those in. Heather is going to be monitoring those, and she'll answer some of them through the actual Q&A box. And then she'll also throw some out to Brian and I as we talk so that we can make sure we address all of them. So we also would like to know a lot about you. We're really excited to learn more about you so that we can target some of what we're going to share with you and to say. And so if you would please go ahead and click on this poll that we've just launched. We would like to know, what kind of experience do you have with data analytics? Is this something that's completely new to you? Are you going to be a beginner in our classes? Or do you have some experience? Or do you consider yourself a complete expert, which is amazing, and maybe you need to prove that somehow for a work situation where you're an expert, but maybe you just don't have the proof per se through a degree or a certificate to demonstrate that. So go ahead and fill that in. And I will tell you too that our students really fall on this continuum. So we do have students who are complete beginners and we have students who are complete experts. So everyone falls in there somewhere.
So it looks like we are just about at 88% voting. So that's great. I'm going to go ahead and close this out and share so that we can take a look.
Great. Okay, so that demonstrates it pretty well. No experts, totally fine. So it looks like a majority have a little bit of experience, and then it goes from there. So thank you for filling that out. That will help us moving forward today in the program. Sometimes my slides don't. There we go. Okay. So let's just start off then, since we do have a good bit of beginners here. What is healthcare and data analytics, and why does it matter? Why do we care? Why does this certificate even exist? So at a very basic level, data analytics is taking data, analyzing it, and looking for trends, patterns. What is the data telling us? What do we notice? And then taking those trends and taking those patterns to make informed decisions. Okay, so in healthcare, how does that relate? So in healthcare, there's lots of data out there. And so it's looking at that data, that healthcare data, again, analyzing it, looking at trends, looking for patterns, and then making decisions in the best interest of the patient. So if we know A will improve patient care, then we can make that decision based on A that the data set is telling us. So that's at a pretty basic level. Brian, did you have anything you wanted to share or an example about healthcare and data analytics?
I think that was a good overview, but I think the main idea is that healthcare analytics is a very problem-oriented field. So the idea is, what problems does healthcare face? So healthcare in the United States has high costs, it has low access. Sometimes it has variable quality. So the question then for hospital administrators or payers is, how do we improve on that? How do we lower costs? How do we help more people get access? How do we improve the quality? And you can do that by metrics. So healthcare analysts do performance measurement, but they also do modeling. So the idea is, if you can help the administrators and the decision makers know more, they can make better choices. So data really is an opportunity to help make better choices, but it's not easy. So the whole field of analytics is helping people such as yourselves transform these symbols in these databases into something meaningful.
Great, thank you, I appreciate that. So why pursue a certificate? There's lots of ways. If you're looking to be educated more in this area, there are lots of ways to go about doing that. And so I have a continuum up here, and I want to talk a little bit about where the healthcare analytics certificate fits in. So on the left-hand side, you'll see there are, gosh, I don't know, millions of online tutorials out there on how to calculate things, how to analyze some data, maybe some little tutorials on like a SAS website or on an Excel website where you can learn how to do little things. But it's not instructor led, so you don't really have anyone to ask questions to. You don't earn any academic credit for those. You don't earn a certificate, so there's nothing to prove or to put on a resume or to talk about in an interview that you have really done. If you're using online tutorials, they're great for just quick things that you might need help with. And then there's the HCA certificate. So right there in the middle, that's us, the healthcare analytics certificate. And by completing our program, you do earn a certificate that is academic credit based. So you complete 5 courses, which I'll talk a little bit more about later, but you actually receive college academic credit for those courses. And you also on your transcript get a certificate. So it shows that you have completed and you have, there's an expectation of the education you have in healthcare analytics. And then on the extreme side on the right is a graduate degree. So you could also enroll in a graduate degree. These tend to be very costly. They're pretty rigid. So you have to apply to most graduate degrees in a very specific timeline, complete courses in a specific timeline, and then graduate maybe within 2 years or so, I would say is a pretty typical master's degree. But they tend to be kind of set in their ways. The certificate is very flexible, and I'll talk about that too moving on, but we have more flexibility. We are lower cost, still instructor led, still supported through faculty, and then also us as the administrators. I'll say too that if you've taken a Coursera class, I would like to say those kind of fit in between an online tutorial and the HCA certificate. So depending on how you took the Coursera class, it could have been very flexible. It could have not been very flexible. You could have paid for it, or you could have done like the 4 week. Some of the classes have like a 4-week preview, but you don't get to actually complete them. And so I would say those kind of fall between those two on the continuum. Okay. So let's talk about career possibilities and sort of where our students end up. So folks are needed who can do healthcare data analytics in a number of different places. So we're looking at public health, government agencies, hospitals, medical groups, insurance companies, diagnostic labs, consulting firms. And within all of those places, there are several different positions as well that our students end up in. So you'll see you will see a list on the left of some of the career titles or positions that our students hold. Now, I'm going to put out there, and I'm sure you can figure this out, but you'll see that we have clinician on there, and we also have healthcare executive. So if you're coming in with no experience and this is going to be something new to you, you're not going to finish our certificate and then all of a sudden be a clinician or all of a sudden be a healthcare executive, right? So these are folks who are already in the field and maybe they use a certificate to take a step up or to take a bump up. If you are new to this, you're probably going to be looking for positions that are a data analyst, public health analyst, clinician support, things like that. And then where are students going? Again, this just kind of repeats the same information from the previous slide, but you can see specific names of where some of our students are. This information tends to be incredibly difficult for us to collect from our students, because a lot of our students, once they earn the certificate, they are on their way moving forward in their career. And so they don't always stop to come back and tell us like, oh, hey, you know, this is where I've ended up, or this certificate has helped me get a promotion, or this is where I work now. So this is not an exhaustive list by any means, but it just kind of gives you an idea of some of the places you potentially would be looking for a position if you would be someone who would be looking for a position and not just staying where you are. Brian, is there anything you wanted to add about the last two slides?
No, I think that was a good summary. I like the list of different titles here. I mean, back to the point, it's not to be threatening that we bring out hospital executives or clinicians, but it's just back to your point there. They're actually in the course, they do well, but sometimes they want to learn how to communicate more how analytics works. They don't necessarily want to become analytics experts themselves, but they want to be better at working with our analytical teams. So there's different ways that you can apply the knowledge and the degree to your world. Some people will actually become the data analysts. Some people will become the communicators of data analysts. Some people will be project managers. So there's many adventures here, which makes it interesting and fun.
Yes, absolutely. That's a really great point you bring up too. And in our classes, our students interact through discussion boards. And so it's really neat because we start every class off having students introduce themselves and what kind of background they do have. And it's really great to look through those discussion posts and see like who's coming from where. We have students make contacts with each other through the class too. So it's really great to see everybody working together. Excellent point.
So we have some questions coming in before we keep moving forward.
Okay.
Let's see, we've got some great questions. So here's one that says, you know, I have a graduate in biotechnology, hoping to start a career in healthcare analytics. Would I need to take data analytics and then this healthcare specialization? Or would I do this specialization first and then look more into data analytics? What path would you recommend?
That is a great question. Tell me again where the person is trying, like what the goal is.
Sure. The question really is about would you need to take data analytics and then this healthcare certificate? And I believe, and Brian, you can correct me if I'm wrong, but that this certificate actually combines both of those together. So you wouldn't necessarily need to do one and then the other.
Yeah, that's correct. So we teach data analytics. We just do it in the domain of healthcare. I think the only thing you might consider is to do a little bit of preparatory work with regards to programming. If you're not comfortable around computers or doing some programming, that might be a little tricky. So that would be something to start. But really, we're teaching how to access data and how to analyze data. We do teach tools like SQL and SAS, we'll talk about more in a bit. But no, you don't need a prior certificate in data analytics, because that's the point here. We're teaching healthcare data analytics.
Yep.
Perfect. And then likewise, would you need clinical experience to be able to complete this certificate program?
You don't need clinical experience. We do have an Introduction to Healthcare course, Healthcare Analytics course, that's offered in the spring. And so that'll give you a bit of a background if you don't have any experience in healthcare. It is recommended, but it is not a requirement. And I would say we could talk further privately with that person just to kind of see exactly where they're coming from. But no, it's not a requirement that you have clinician experience or healthcare specifically. I do want to take this opportunity too to say that this program is geared towards healthcare in the US. So if you are somebody who's outside of the US and you are planning to use the information outside of the US, you should know that it is geared towards US policy and healthcare. We cover some of those things. And you would still get good information and you would still learn how to do data analytics, but you would need to know that there is that, spin isn't the right word, but the focus, I guess, would be on the US healthcare system.
Excellent. Let's see. Okay, and then there's a question about computer programming. I'll know we'll get into that a little bit more as we move forward. So let's go ahead and keep going. And to anybody who arrived late, this session is being recorded and you will get a copy of it after we're all done. So no need to take vigorous notes. You'll have a recording later. So let's go ahead and keep going.
Perfect. Okay, so if you have a chance, go ahead and launch the next poll. We'd like you all to engage with this and let us know, what are your goals? What are you trying to do by completing this certificate? There's, like Brian mentioned earlier, it's kind of a choose your own adventure, right? So there's so many different things that you can do with this certificate. Some people will really want to get into the weeds and they want to be the one analyzing the data and they want to specifically do it for a hospital. Other people want to be the project managers who need to learn how to speak the language and know how to communicate with the analyst and then communicate results maybe to management. So there are lots of different ways. So go ahead and choose your answer there. Again, going more towards the poll answers, we have folks who are looking to break into this industry. We also have people who've been doing it for a little while and they're seeking a promotion or they want to change positions and they either need to up their knowledge or they need to earn a certificate to show that. And then again, people who just want some more formal education. Maybe you're kind of self-teaching right now and you want some formal education in this area. Results or other goals. I didn't mention other goals. So it looks like we have folks in every single category, a good portion in there currently in healthcare and looking to get into analytics. And I will say we do have a lot of students who fit that realm. So maybe you're in nursing or maybe you're doing something and the data is just really calling to you and you understand how important it is and it's interesting and that's where you have some strengths and you're looking to pursue that. We have a lot of students doing that. And then other goals as well. So I'm interested about those. So we can talk about those in a little bit, but you're also welcome to, like I said, email Heather at the end and let her know what your goals are so we can make sure that this certificate would meet those for you. Okay. The key is to hit the button 4 times, I have realized. We'll get it. Okay. So instructors, let's talk about our instructors here for a bit. We do have some rotating instructors, so not everybody has their picture up here, but these are the folks who are teaching with us now. We are very proud of our instructors. They come from a a breadth of backgrounds. They are not all faculty members. Some of them are. All of them do this work in their daily jobs and are very, very passionate about it. And so I've invited Brian to go ahead and kind of talk about their philosophy, like the instructor's philosophy with teaching the classes, and any other thoughts that he has with instructors.
Yeah, so I think one of the first things to note is we're here to support you. And I already mentioned the idea about choosing your own adventure, because we acknowledge that we have a diverse group of students with different backgrounds. We also know that a lot of people, maybe everyone's already working with families, counts, working at a job, whatever it might be. So there's lots of commitments. We understand that. So there's flexibility in deadlines. I mean, we try to keep people honest with getting work done, but there's flexibility. We're here to help you learn. Some of it, we encourage you to do some of your own research. We'll provide readings, we'll provide links. We want you to put out effort, but we're here to answer questions. And as I said before, you need to think about what you're good at and then what you want to improve upon. So some people are already a doctor, they want to learn more about programming. Some people are programmers, they want to learn more about clinical knowledge, which is important. So for those of you that aren't in healthcare, it is an opportunity to learn a lot about healthcare. As I keep telling people, analytics is about analyzing data, but you can't analyze data unless you know the domain of what you're trying to understand. So you have to understand the language, the codes, the culture, what is healthcare in this country. So that's a lot of what we teach. It's analytics, data, a lot of technical stuff, but also like in the discussion boards, we teach about sharing information with each other. So I do think that's one of the value of the groups we have, is we have such nice diverse groups of people that can share all these different backgrounds.
Excellent, thank you. Yeah, and a point I would just like to highlight too, Brian touched upon, but one thing that really sets us apart from a Coursera course or from an online tutorial is that you have an instructor assigned to your class. They are going through the course with you. And so although, and I'll talk about the structure of the courses in a minute, but although the courses are asynchronous, meaning you don't actually meet up at a specific time, they are always online, responding to your emails, responding to your questions, posting on discussion boards, helping you out with assignments. So they're there. Some of them have office hours. It kind of just depends on the class and the need, but they are there supporting you through the entire class. So I think that sets us apart from some of the other programs. Okay, so let's talk about, well, actually, Heather, should I pause for a minute or how you doing? Are you there? Heather? Brian, can anyone hear me?
I'm here.
Okay.
I don't know if Heather.
And Carrie, raise your hand or raise their hand too. Thank you. I'm going to keep going then. Okay, so the program structure, let's talk about what it actually looks like. So in a broad sense, the certificate consists of 5 courses. These are fully online. You do not have to come to Davis. You don't have to come to California. Again, you don't even have to come to the United States. They are fully online. You complete everything online, which is why Brian said you really need to be comfortable using your computer. Besides the obvious fact that it's data analytics. So all the analytics is done on your computer with programming and using data sets and whatnot. So that's a really important piece. The way that it works is that it's asynchronous. And again, that means that you don't meet up at a specific time. So you don't log in every Tuesday at 3 p.m. for class. The way it works is that all your course materials for the week are released on one day. Excuse me. For most of our classes, that is Tuesday. So on Tuesdays, you'll have a lecture released, reading assignment, potentially another assignment or a project or something like that. And you'll have a week to complete it. So you'll have from Tuesday to Wednesday. So if you're working night shift and you want to do your homework and watch your lectures at 2 p.m., great, go for it. If you're working an 8 to 5 job and you want to do your stuff at nighttime, awesome, that works too. So it's up to you to manage your time for that week and to get all of the information done. And then on next Tuesday, week 2's information is released, and then it progresses that way throughout the 10 weeks of the course. So each course is 10 weeks. And again, that's working through week by week. You can complete all 5 classes in 15 months or less. That would be moving through taking 1 class a quarter and not skipping any quarters. Now, we are lucky in the fact that we are flexible. So if, let's say, I mean, right now, a lot of our folks are super busy. And so they've decided to take fall quarter off. That's fine, not a problem. You just want to check in with Heather and make sure that you know when you're taking your classes next, because not all classes are offered every single quarter. So it's just a little bit of academic planning on your part, but you can also move through quickly if you want to. Students often ask, well, should I take 1 class or 2 classes? And I would say, unless you're somebody who has taken an online class, an academic online class, we're talking either an undergraduate or graduate degree course online before, I would always start with 1 class. I think our classes tend to be a little bit more rigorous than sometimes people expect. And so I would say start with 1. And then if you just do amazingly well and you feel like you could dedicate double that amount of time to a second course, then by all means, second quarter, go ahead and take a second course. What is composed of our classes? So there are lecture videos. All our lectures for this, since it's asynchronous, are pre-recorded. What that means is you can download a transcript. So if you're somebody who would prefer to read versus audio listen to a video, you can do that. You can also pause recordings or rewind them and watch them again. So that tends to be really helpful for some people. Most of our classes also have either a reader or a textbook with different assignments or articles that you read. There's exams, assignments, and 1 class right now has a presentation, which you do meet up with synchronously with the rest of your classmates. And that's a course towards the end of the certificate, and it's just it's a one-time deal. And that's something the instructor works with you on. Questions about the structure? Okay. All right, so here's our course schedule. These are the 5 courses, and you'll see that each of them is 3 units. Again, those are academic units given by UC Davis. So you are earning an academic, or you are earning academic units for the courses. You can request a transcript. These are courses that you can look to transfer in for an undergraduate or even a graduate degree, potentially somewhere if you decided to pursue a degree. And again, you can see the offers column. We don't offer every class every single quarter. It's on an every other basis for now schedule. And so all of this is just posted on our website, so you can take a look and kind of map out and plan for yourself, or that's something that Heather can help you with as well. Okay, so we're really lucky to have Brian with us here today because he teaches the second course in the certificate, the Healthcare Data Acquisition and Management course, and that one is being offered in the winter. And so I'm going to turn it over to him and let him talk about this course and then also the other course that he instructs to.
All right, so this course, HCA 201, Healthcare Data Acquisition and Management. A lot of this course is about relational databases and accessing data in those relational databases. So a lot of you have heard the word SQL or SQL. You've also heard about Hadoop and maybe more other different types of databases. But in American healthcare, most of the data is stored in relational databases. You've heard of vendors maybe like Oracle or Microsoft SQL Server, Postgres, MySQL. A lot of this course is about helping you understand how these data get stored in relational databases and how you can query them with SQL. So we talk about data harmonization, bringing data together, maybe looking at data quality indicators. But the reason why I'm kind of happy and proud of this class is I was able to extract a whole bunch of data from Medicare that was then made synthetic. Another word for that is fake. But the data started as real, then they were transformed into something that you can use. And then I put them into this new data model called OMOP, which is a common data model for representing data for researchers. So really what you have here is pretty realistic data, and you have a ton of it. And so for those of you that have smaller PCs, I have a smaller database. For those of you who have larger PCs, more skills, I have a huge database. What I do is I have people download a little MySQL app. So MySQL is just a small little light way, or actually, sorry, SQLite. SQLite's a small way of querying the data. What I do is I give you an opportunity to run real queries that I actually run at work. So we use this OMOP data model to coordinate harmonized data among all the University of California campuses. We run a national precision medicine project with this data model. So you'll be exposed to something that's national. It's international. The entire country of South Korea, their data is all organized in this OMOP data structure. So there's opportunity to learn about the data structure, about the underlying codes. So one person in the chat was saying, are you going to learn about medical codes, and is it relevant to Canada? Yes, this is international, because what's now becoming common is that people want to use standard codes, not just ICD or CPT, but SNOMED codes and LOINC codes and RX norm. So you're going to get exposed to standard international vocabularies that would apply from Africa to France to Mozambique, wherever you want to go. I think there's a big value proposition here. It can be challenging if you've never programmed before. Learning a little bit of SQL takes a little time, but it's really pretty easy. I've had people that get a little bit worried, but then they go, oh, wow, SQL's just select some rows from a table and filter out the rows you don't want. That's how simple it is. And of course, it can get way more complicated, but I asked you just to learn the basics. And then when you know that, you won't be able to be tricked by any programmer in some organization that says how hard it is. Some of it's hard, but a lot of it's easy. And every student succeeds in writing SQL queries. So I think it's a pretty fun class, and I look forward to seeing many of you January 13th.
Great, thank you. I'm just quickly going through chat and question and answer. Heather got kicked off of her internet, so she is working to get back on here. And I'm just skimming through. I'm seeing a lot of questions on things that we'll cover coming up, so I'm not going to answer those right now. One question was, do the classes need to be taken in a specific order? And we do have a suggested order, which was the list that I put up there. That's actually the order it's supposed to be taken in. It's also listed on our website. However, we are flexible. So if there is a reason that you need to take them in a different order, if you need to start with a different course, we can talk about that, and tend to be, for the most part, pretty flexible. So I'm just scanning real fast. Oh, so there's one question about, can we finish the classes quicker than the 10 weeks? And no, these courses are not work at your own pace. So even though they're not synchronous, they're also not at work at your own pace. So it does take the full 10 weeks because you don't get access to everything all at the beginning of the course. It's on a week-by-week basis.
Hi, Chelsea, sorry about that. My internet kicked me off there.
Welcome.
Thanks. I did see one question come through about classes you should take before this certificate, and things like Excel. I don't know, Brian, do you guys actually spend much time in Excel, or are you actually in the data management software that's particular to this genre?
Excel never hurts, because that's what I call like the lingua franca, the language of choice of the world. So everyone uses Excel. So there's no problem learning Excel and getting skills with it, because what happens is you'll often do this fancy algorithm, you'll do all this database work, and then people say, well, give it to me in Excel and format it in Excel. So that's good. But we encourage the use of SQL and SAS and a little bit of Tableau. So I think if students are asking what can they prepare themselves to get ready a little bit, I would say less Excel. To me, the most important would be SAS and then SQL. I say SAS is important because it's used in the statistics class and in one of my other courses, and then also in the data mining class. But we do have a primer on SAS, and we do have some tutorials online, and we do help you work through your coding issues as you are in the class. You don't have to be a SAS expert, but if you wanted to get a little bit ahead, if you really feel nervous about it, then learning a little bit more about SAS and SQL would help. But don't be deterred if you're not a SAS programmer, because we teach you what you need to know. And sometimes for people that really don't like programming, they're a doctor, an executive, they'll never be a programmer. I can provide example code, and if they can edit and run it and explain it, that can be good. So there are different options. And if there's a bug in your code, you don't get punished. So I guess I'm trying to let you know that there are a lot of different opportunities to how you engage with programming. And like I said before, it's not as hard as it seems. It's really like typing something in English. You have to just get the basics of the syntax and then test it out.
Yep. And something that you touched on, and then some folks were asking as well, is that SAS Primer course. So we do actually offer a 6th course, and this course is called the Sas Primer Course. It's also offered in winter, and it's for folks who really don't have any coding or programming experience. And what we do is we use SAS to teach you the basics of coding. And so kind of how Brian was alluding to as well, once you understand the basics of coding and how coding works and errors and bugs and those sorts of things, it's relatively easy to apply the same lessons to a new language. And so getting that basic understanding is really helpful. If that's something that you don't have, we highly recommend taking the SAS Primer course. The SAS Primer course is shorter, it's 6 weeks. It is totally work at your own pace. So you receive all the information at the beginning of the class, and then you work through the videos. It's not an academic course, you don't get credit for it, but there is an instructor. So Tim, who is on the instructor slide, he's the one who is helping you through and teaching you those codes and helping you debug and things like that. So it's a much less pressure course. It's really for your benefit to learn to be ready to start the other courses in the program. And I talk about that a little bit more coming up here. Okay, so here, Brian's touched on several of these things already, but you can see the box there that says tools used. So these are tools that are used throughout the course. Throughout the certificate. So depending on what the course is, some of them use SQL, some of them use SAS, some of them let you choose what you want to use. So maybe you want more experience with SAS or you want more experience with SQL. For some courses and some assignments, you can choose which one you would like to use. And then as far as the data goes, you'll learn about data preparation, analysis, and presentation. So that kind of takes you through the certificate is, how do you load and validate data? How do you analyze it? And then how do you present it so that other people can understand the findings that you have? Okay, so this is a common theme too, going through the question and answer box. How can you be prepared to succeed? Because your success is very, very important to us. That's why we're here, and we want to make sure that you are successful. So we do have one thing that is required, and that is a undergraduate level statistics course. So statistics is the basis of everything that we do. You need to come in knowing how to run basic statistics. I'm tripping over my words. Basic statistic problems. You need to know the basic vocabulary. On our website, we have an inventory that you can take to know if you have that or not, or maybe you should take a brush up course. Coursera has many, many statistics courses you could take, but you do need to have that knowledge coming in. And then we have a bunch of recommended things. So experience with SAS or some other programming language. So maybe you use R all the time. I think you would be fine coming in and just learning the nuances of SAS as we go through. If you don't have any experience, again, taking that SAS Primer course will do you good. Some prior experience in healthcare, again, recommended, not required. If you don't have any experience in healthcare, it would help if you started doing some research or some reading online, so you come to be familiar with the different terms that are used in healthcare. Prior data management experience. So are you comfortable handling large sets of data? Can you move files around your computer? Can you download and upload and log into different data sets and those sorts of things? And strong analytical skills as well. So that's what we're doing is, right, using data, breaking it down, manipulating it, taking a look at it. And these courses are geared to folks who have completed a bachelor's degree. It is not by any means required, but you need to know that these are decently rigorous courses, and we do expect you to be putting in probably 8 to 10 hours a week, depending on how much experience you have. I have students who put in far less because they're already really comfortable and fast with programming. It kind of depends on your experience there. Anything to add, anybody, or questions?
We did have a question that I thought was a good one about how much time should you prepare to spend working on the class materials and things like that.
Yeah. Yeah, so again, I think it has to do more with, it's very dependent on the student, right? So if you have a lot of coding experience and it's fast and easy for you, and you tend to kind of just whiz through projects, then it could be 4 to 5 hours. I would say if this is going to be something that's pretty new to you, then especially at the beginning, I would budget, gosh, anywhere 6, 8, 10 hours. 10 would be pretty extreme. But while you're watching videos, doing readings, and then also working on the projects. Anyone to add or questions? Okay. Okay. So why should you choose UC Davis Continuing and Professional Education to continue your education in this area or to start your education in this area? There are several different reasons that I think give us a competitive edge over some of the other programs out there. So the first is that, like I said several times, these are academic courses. So these courses have been designed by faculty, professors on campus, and they have been approved by the UC Davis Academic Senate to mean that, yes, UC Davis is behind this class, and yes, we say that you can give academic credit for these classes. And then they're taught by professionals, though. They're taught by people who do this every single day in their life. And so they know the ins and outs. They know how the information is applied to work and applied to their everyday doings. And I think our instructors are a huge bonus. Again, because they can provide that, and they're live, they're real people, they're there taking the class with you. We're competitively priced, especially if you're looking at some kind of degree program. You also pay per class, so you don't have to pay a lump sum at the beginning. You pay as you go per class. So if you take a quarter off, that's fine. You're not paying anything that quarter. When you sign up to take your next class is when you pay the tuition for that class. They're tailored for quality and content. Like I said, they're approved by UC Davis Academic Senate. Diversity of perspectives, like Brian said, our faculty, our instructors are coming from a wide breadth of backgrounds. And so they're providing those different experiences that they've had. And you get to gain and learn from those experiences. These courses are not overview. This is not a simple, like, here's kind of what healthcare data analytics is. No, you are in there doing the work and you are learning the skills to be able to apply those later on to a position. And then you also, this is kind of a new thing, not only do you earn a certificate, so we print you out like a nice little certificate that you can hang up, but you also earn a digital badge. And so if you are active on LinkedIn or some other social medias, when you complete the certificate, actually get this digital badge and you can attach it to your profile. So you can demonstrate to everybody that, hey, I've completed this certificate, this healthcare analytics certificate with UC Davis, and show that off. Okay. So this is a part that everybody is usually interested in hearing. So the courses are $1,200 each, and there is a certificate registration fee. So in order to complete the entire certificate, it is $125. That pays for a lot of the administrative behind the scene things that Heather and I do. It also pays for Heather to track you and to check in with you frequently about what classes you've taken, what your next class is, and kind of walk you through that process, and ensures that you're actually completing the certificate. And we want you to try out our first class, try out a class before you pay this $125, because maybe you take a class and you decide, yeah, you know what, that wasn't exactly what I thought it, or that wasn't what this isn't what I want to do right now. And that's fine. We just ask that you pay the $125 and register for the certificate by the end of the second class so that we can make sure that we are tracking you accurately and helping you through. Like I mentioned, you pay as you enroll. So it's not a lump sum. As you register for a class, you pay the tuition. Textbooks and readers are additional. I would say not every class has a textbook and reader. And a lot of textbooks nowadays you can rent online, which is really handy, or buy used copies. We have a couple discounts listed there. And then some of the payment options we work with, if you're taking out loans, we have advice on that. We accept some GI Bill funds and job training funds as well. And then when Heather emails all of you with the recording of this, she's going to give you a code for $100 off your first class just for attending today. Heather, did I miss anything about finances?
I think that about covers it. We mentioned earlier our SAS Primer, and did we mention that you get that for a discount if you're part of the certificate program?
Did not.
Okay.
Yes, so that that class, like I said, it's shorter and it's not for academic credit, it's not as rigorous. And so that class, I am blanking on the price, but it's around $600 for that course. And then if you have already registered for the certificate, I believe you save another $100.
I think it's closer to 300.
Oh,
so it's a nice savings on that.
Thank you. It's been a minute since I've looked at the prices. Yep, so it's quite a sizable discount. Then definitely worth, if you think that's the direction you're going, it's definitely worth signing up for the certificate when you register for that class to get your discount. Thank you. All right, we got another poll for you. So you've heard the three of us talk and answer questions. We're gonna stay on, we're not going anywhere right now. But I just want you to take a moment and think about what is your next step. So now that you know some more information, have we answered all your questions? Are you ready to start, ready to sign up for the certificate? Do you need to think about it? Certainly would be understandable. It can be a big commitment. Do you have more questions? After listening to us and asking your questions, have you maybe decided the certificate's not what you thought it was? Let us know where you are at.
All right, we're just at about 50% here. We'll give it another second to let folks get that in.
Okay. That sounds good. And then again, after this, don't go anywhere because we're going to keep answering questions and then give you some more contact information as well.
All right, I'm going to go ahead and close this down so we can see what we have here.
Excellent. Okay. Great. So again, we have folks in every single one of those categories, which I think is great. I think that means we have, for the most part, done our job of answering some of your questions, giving you some things to think about, and then also clearing up maybe again, it's okay if this isn't for you. We want to figure that out beforehand if possible. So those of you who are ready to sign up, that's great. We're super excited to hear that. Winter registration is now open. You can go to our website and go ahead and register. If you need help deciding for winter what class might be best for you, then we'll go ahead and have you email us and talk with Heather and she can help you figure that out. Oh. My goodness, computer. Yay, okay. So question page, and then I'm just going to put up this last one. So you can directly reach Heather at healthinfo@ucdavis.edu. And again, she can help you choose classes. She can give you recommendations. She can kind of talk through, do you have the background? Are you ready to move forward? Do you need to take the SAS Primer course? Some of those things that we're not able to address in this large public arena that we have going on right now. You can also call that phone number too. We, of course, like most people, are working remotely right now. So that there is a very good chance that phone will not be picked up, but leave a message, we will get it. And then we can either schedule a phone call or email you back. To get to our website, you'll want to go to cpe.ucdavis.edu. From there, click on courses and programs. From there, health sciences, and then you'll see the certificate and some other things that we offer in health sciences. And you can check that out. Again, as a reminder, the certificate is called Healthcare Analytics Certificate Program. All right, you want to go ahead? Same question?
Yeah, I have, I'm going to go ahead and put my calendar link into the chat here for everybody who's here today. So if you have more questions and you want to have a Zoom chat or a phone call, you can simply go to this link and find a place on my calendar to connect. And so that's going to be right there. And then we have some great questions coming in. A couple that are about job placement. As far as I know, we don't have any job assistance connected to this program. Is that correct, Chelsea?
That's correct. We don't have any job assistance. I do encourage us to connect with each other through class, connect with your instructors, see what's out there. Sometimes we're able to help each other out. When people like alumni contact me or people I know in the industry contact me and let me know that they have jobs, we do put those up on our LinkedIn account. I think I forgot to add our LinkedIn. We also have a LinkedIn. It's Continuing in Professional Education Health Sciences for UC Davis on LinkedIn. You're welcome to join us there. And we post things as we can, but we do not have any formal job placement or career advising.
Okay, excellent. We've got a question about the course materials. Where would they be available? So can we talk a little bit about Canvas?
Sure. Yeah, so when you get enrolled in a class, we use a platform called Canvas, and Canvas is the learning management system where we post lectures. We break everything down into weekly modules and then release things based upon date. So when you first log into the class, you'll have a whole page that talks about recommendations of how to work your way through the class. The syllabus will be posted. You'll be able to message instructors and me and Heather through this Canvas system. It also provides links of where, if you have a quiz, like you would take the quiz inside Canvas. You can upload your assignments and you can read what your assignments are. So that's, once you're registered for the class, that is where you'll get all the course information. Is that what you're looking for, you think?
Yes.
Okay. And if you
sorry, go ahead.
Oh, I was just going to say, if you ask that question and that's not what you're going for, or if you wanted more, just type it back in.
Yes, and I see some folks, I see like raised hands flashing up sometimes. In this format, we can't do answer raised hands. So if you just type it in the Q&A, we're going through all those here in the Q&A. So that way we can get your question answered. Quick question here, is there flexibility to take only 2 classes a year?
Sure. Yeah, the only requirement we have for you to continue moving forward is that you have a total of 5 years to complete the certificate. So if you started in winter 2021, you would have from winter 2021 to 5 years from there to complete the entire certificate. So yeah, if you took 2 a year, then you would finish in 2.5 years. So that would be fine. Mm-hmm.
Okay. What else do we have? Let's see. Do you think this program is generally good for data analysts in other fields as well? Brian, that might be a good one for you.
Oh, so if someone came from a different analytical field, let's say finance, and wanted to come to healthcare, if that's the case, yes.
Okay.
Or was that the context of the question?
I think they might be looking just for, can you use this to get into the field of data analytics in general?
You could. I mean, programming languages cross-cut all different disciplines. Our value add, I think, is bringing analytics plus domain knowledge. I really think that's kind of the critical thing. I think a lot of people think you can just analyze data. It's just all data, it's raw. No, you have to know the meaning, the people, the workflows, the politics, the culture. It's pretty important. So I wouldn't completely discourage someone from taking the class if they're just a generalist, but I think we really are anticipating people focusing on healthcare.
Excellent, thank you. And let's see, can you do only one certificate course instead of all 5 courses?
Can you do just one instead of 5? You can. There's nothing that would require you to finish the certificate. I would say the certificate is geared, or our classes are geared to complete all of them. But if there's only one that is super interesting maybe to you or very much pertains to your line of work, then you definitely could take just one. I would say if it is not the first or second course in the series, then you're going to want to talk to Heather just to make sure you have the background to take that course by itself. I see a couple other questions in here. We are recording this and we will send it out. So if you came in late, no worries. We're going to send this out to everybody. We don't only use SAS. Someone was asking, do we only use SAS in the program? We do not. We use SQL, we use Tableau and some. There is a wide range of programs that we use, or languages, excuse me.
And if someone's not a SAS lover, they love Python, in some of the courses we provide data. And if you want to use Python or R, you could, or Stata. Someone I think mentioned Stata. It's just that we provide a lot of example code in SAS in some of the courses. And so it's not like we really favor one language. We consider them tools. Each tool solves the problem a little bit differently, but also in a way, many times quite similarly. So there's opportunity for flexibility, but SAS is a focus on some courses.
Good, thanks.
I think you touched on this earlier, Brian, that we can, folks from Canada, the terminology would transfer over. Is that correct?
I think so. I think a lot of the codes we look at are standard. Some of them are going to be American specific, but we do talk about SNOMED and LOINC and more very international codes. I think the Canadians use, ICD-10 codes. They're probably ahead of us. Maybe they're to like IC11 or something. That would be something we could look up, but I think it would be 80% crossover of the codes between the US and Canada.
Excellent, thank you. There's a question here about software programs. Do they need to purchase any software programs beyond what they pay for the tuition?
No, this little SQLite for SQL is free. The SAS is going to be available to you for free. It's a little SAS Studio online environment. If you want to use your own tools, then you use those. So no, to my knowledge, no extra fees.
Excellent.
Textbooks
sorry, Chelsea, go ahead.
Oh, I was going to say, that's correct. The only thing would be textbooks or readers.
Okay. Question here about, have we seen, and I think we have, a medical coding background transition into data analytics with this certificate? And I believe we have that in our records, actually, specifically.
But that's a classic.
Go ahead.
I think we've seen that category of student, and that's probably the classic, what I call domain knowledge plus analytics. So if you're an expert in medical vocabularies, terminologies, you are valuable, and you become way more valuable once you then can analyze data as well. So that's another, whenever you can bring in some type of domain knowledge, in this case, being a medical coder, that's very important and very commonly sought after in the industry.
Good, thank you.
And then one person is asking, when we're just about finished up here, but we've got one person asking if we could see the slide that had all the 5 courses on it again. Can we back up to that?
I can absolutely try.
Okay.
Oh my goodness. That's gonna make me
I'll let you there. And then we're just about finished with our time today. We want to be, cognizant of everybody's schedule. If you have any other questions, feel free to type those in now. And then, as we've mentioned, you'll be getting a follow-up email. It's going to come out automatically 24 hours from this session, and you can respond to that if you have any more questions or would like to make an appointment to chat about your particular situation. So you can keep an eye out for that. And we'll just give it 1 second to see if anybody else has any more questions for us while we're here today. It's looking really good. A question about when did the session start? That's a great question.
The courses?
Yeah.
Yeah. So, Yeah, you know, I didn't touch on that at all. So we run on the quarter system at UC Davis. So there are 4 quarters a year. There's a session in fall, winter, spring, and summer. So we're just finishing fall right now. And our next session starts winter. So I believe it's January 13th is when our next quarter begins. So you have a little bit of time to think about it. You can register up until a couple days and sometimes up until the day of class. And the class that Brian talked about, the healthcare data acquisition and management class, is being offered. And the SAS Primer course is also being offered. So those could be 2 potentially good options for you.
Great, thanks. And that's all going to be right there in the middle of January. January 13th, I think, is the first day of our classes. So maybe for the new year, make sure you're enrolled so that we can get you all set up and ready to go.
Yep. Excellent. Well, I want to say thank you to everybody, to Heather and Brian, especially for being here and helping make sure today went smoothly. Thank you to all of you for being here. It's really great when we have an opportunity to reach out and talk directly with our potential students. So you have the ways to contact us. Again, you'll be getting an email with all the information as well, and a copy of this recording so that you can watch it again. Feel free to forward it on if you have friends or folks who were interested as well and couldn't attend today. So thank you. We appreciate it. And we hope to hear from you soon.
Thanks, guys. Have a good one.
Thanks, everyone.